So you were just advised to report to your office. What do you need to know? Hello guys, welcome back to my channel. It's me again, and we are back for another learning video. So today we're going to focus on a very important topic, which is all about preparing ourselves as we return to our offices. So it is now more than 2 months since the first day of the community quarantine, and most of us in the workforce are probably asking, how is it going to look like, or what is it going to look like when we return back to our offices? Is it going to be just another normal day, or a day of a new beginning? The beginning of the many changes to how we are going to work in our offices. Today we are going to answer some fundamental questions, so if you find this video informative and would help your organization and your colleagues to prepare themselves before returning to your office, please don't forget to subscribe and share this video so we can all create awareness to everyone who's returning back to their offices soon. Now, the lockdown of the community quarantine in Manila is extended until end of May, but restrictions were eased elsewhere in the Philippines. The government had also released their easing of the lockdown measures for certain industries like BPO, supply chains, and companies producing essential products and services like food and medical supplies. In this case, other industries will still have to follow the movement, and their employees will still be advised to stay at home. No one will be allowed to go back to office. But one thing for sure, when we are back, our office job will no longer be the same. So today, let me share with you some of the protocols and the things that we should know and what we should do before, during, and after reporting to office. Now, these protocols are already being adapted by different organizations. So if you find this video informative and would help your organization and your colleagues to be more aware, please don't forget to share the video. So in my organization, the main focus is safety and practice of social distancing to protect our employees from possible risk and contamination or contagion of COVID-19. So I'm going to cover two aspects. One is in the workplace and the other one is for the employees. So first up is the workplace health and safety measures. So what your company should do to keep you safe in the workplace. The protocols, policies, and procedures should comply with the occupational health and safety requirements of major governing bodies on establishing a COVID-19 workplace prevention and control plan. So this will include the World Health Organization, Department of Labor and Employment, DTI, and the Department of Health in the Philippines. So we will discuss these measures so that your company or your organization is all set for your return to office. Alright, so let's talk about the preparation part. And here are some guidelines and protocols to follow to ensure employee safety in the office. Number 1, reduced office occupancy. As mandated by the government, we must follow the regulation of a return to a maximum of 50% office occupancy. But this can only be achieved if your organization has already plotted your shifting schedules as well as the seat plan rearrangement. Number 2, office deep cleaning and disinfection. Now, prior to the reopening of offices, deep cleaning and thorough disinfection should be conducted, and all staff must be briefed on the safe use of cleaning solutions and the risk and exposure levels. Number 3, work units disinfection. The computer units issued to the employee who is working from home will have to undergo thorough sanitizing before reassembling, and these computers will have to undergo virus scanning before reconnecting them to the office network system. Number 4, workstation allocation. There should be at least one workstation or a minimum of 1 meter distance between occupied workstations. No employee should be seated at workstations that are face to face. Number 5, physical distancing in common areas. Common space areas, pantries or coffee areas or nooks will be reorganized to adhere to physical distancing measures. Dining areas, on the other hand, should have only 1 staff per table and 1 meter radius between staff. This is an ultimate solitude when you are eating your meal in the office, but oh well, we have to follow. Number 6, safe dining. Now, dining in work areas may be permitted following strict workplace eating etiquette. That means no food that emits strong odors, liquids away from your hardware, proper disposal and cleaning shall be observed, and never eat and work at the same time. So if you are having your lunch, plug out for a moment, enjoy your meal. Number 7, Cleaning and disinfection of common areas and high-touch surfaces. High-touch surfaces may include biometrics that you're using when you enter the office, and scanners that shall be regularly disinfected. Number 8. Availability of sanitizing stations. Sanitizing stations shall be set up in numerous locations around the offices to enable frequent hand sanitation and provide supplies for staff's proactive sanitation of their workstations. Number 9. Traffic and access control implementation. Now, these traffic control lanes and one-way traffic rules in high-frequency hallways shall be implemented where possible, and there should be designated area for equipment receiving and deliveries. Number 10. Continuous COVID-19 information drive. Signages, reminders, and other information on practicing mandatory physical distancing, safety behavior, and personal hygiene shall be installed or posted in key areas of the workplace and through online announcement. Now, aside from this, what all of us should do to keep everyone safe in the workplace? Number 1, if your organization has already set it up, you should be filling out an online form about COVID-19 risk assessment and to check whether you are fit to work or not fit to work. This shall be done by your healthcare professionals in the office, maybe a nurse or a doctor that would assess the result of the survey. Number 2, mandatory temperature check, because this is highly important. As you enter the office, everyone is required to undergo temperature check. Number 3, the use of elevators and staircases. You might be wondering what are the markers for when you enter the lift or the elevator. These are intended to observe physical distancing when using building elevators. So follow restrictions and regulations on the use of these elevators and staircases. And number 4 is mandatory wearing of face mask. It is highly important that employees and guests must wear their mask at all times and only remove them when necessary, like times when you want to eat your meals. So you can expect that there would be a daily COVID-19 symptoms questionnaire as mandated by DOLE and DTI. Now, employees shall be asked to confidentially report should they have the COVID-19 symptoms. And here are some of the things that you must always practice when you are in the workplace. Number 1, avoid social gathering. Like for example, group lunches, catering, or other in-office group events. Avoid close physical interaction with other employees. So instead of face-to-face meetings, use virtual conferencing tools if possible. Now, one of the things that we must also consider and we must also continually do is to increase our physical and mental resilience. Number 1 is frequent hand washing and sanitizing following the 20-second rule. Number 2 is to prevent the habit of touching your eyes, face, and mouth. 3 is to have adequate rest and at least 8 hours of sleep. 4, eating nutritious and well-cooked food. 5, drinking plenty of fluids and avoiding alcoholic beverages. And 6 is to exercise at home regularly. Now, if you feel like sneezing, sneeze only into your elbow or your sleeves. Like that. Now, you might be asking what's the protocol for suspected COVID-19 case inside the office premise. So, let me show you how. Number 1 is to check whether the temperature is above 37.5 degrees Celsius. If found to have 37.5 degrees Celsius, that person should proceed to the isolation area, which will be assisted by the health professional or the designated nurse to assess the health of the person. Now, if the person shows no COVID-19 related symptoms, but the temperature is still high even after 5 minutes rest, he or she will be sent home. So in this case, employees may utilize his or her accrued leave or sick leave or continue to work from home if applicable. Now, if the employee is found to have COVID-19 symptoms, what should be done? Now, if the employee is confirmed to manifest strong COVID-19 symptoms, the nurse or the safety officer of the site shall recommend the person to be sent to the nearest hospital for proper testing. The nurse will also have to coordinate ambulance services to transport suspected case. Next is to request for the cleaning staff to decontaminate the work areas where that employee is sitting. The colleagues or the employees who are present in the work area shall be required to undergo 14-day home quarantine. Now, in this case, the employees can either work from home or if not, they can also utilize their accrued leave credits. Now, it is also essential and practical to do some self-check. So if you're feeling sick, might as well stay at home, inform your supervisor, and do the necessary arrangement. So there you go, guys. I hope you find it informative, and if you think that this is essential for your company and for your colleagues, please feel free to share the video. And please don't forget to subscribe and click the bell button so the next time we upload learning video, you will get notified. Thank you and have a good day. Bye-bye.